We are in streaming.
Okay. Good afternoon, everybody. I am Giuseppe Parisi. I am the president of the Italian Society of Medical Education. I am glad to introduce this meeting. It is a part of a series called Educational Cocktail, or because of this is a happy hour time. And this meeting is also part of a set of meetings about innovation in undergraduate medical education. We have now the opportunity to listen to colleagues working to innovate curriculum and to use new method of teaching. So today we are meeting Professor Anne von Lameren from the University of Groningen, Netherlands. And I am particularly proud because this is the first meeting about innovative curriculum, the first international meeting about innovative curriculum. So we have a lot to learn, and Professor Antonella Lotti, the chairwoman, introduce you to Anne von Lameren. And the objective of the meeting and our program for this afternoon.
Thank you, Pino, and welcome to Anne and Azal. I'm very happy because I'm sure that this webinar will be very inspiring today and very interesting. We are, as Pino said, our president, we are very happy to opportunity to illustrate some international curriculum, innovative curriculum, because we think that it's important to see how other universities, they train their medical and health professions. We are in Europe, we are talking about a 6-year curriculum, so it's like in Italy. And we are very happy because this curriculum is an innovative program, is a problem-based, student-centered, competency-based, interdisciplinary. And so it has all the characteristics that we like. I'm very happy to have here Anne van Lameren. Anne van Lameren is a medical doctor. She graduated at the University of Maastricht in the Netherlands. So she was trained by problem-based learning, and she is a psychiatrist, and she is the chair of the Bachelor Program for medical students in the Netherlands. We met in 1987 in Maastricht when she was a fifth-year students at the medical school, and we became friends. At that time, I was a PhD student at the University of Bari in Italy, and we were starting an innovative program. It was a parallel track, which was problem-based. And we invited Anne to stay with us for a semester. And during this semester, she trained our teachers there. She trained us, she taught us how to write a case for PBL, how to run a tutorial group, how to create a skills lab, how to create a NOSCI examination. So we are very grateful to Anne. Then Anne, she is a good friend, and she comes to Italy very often. And so we hope that she will come again to train us, because in Italy now there is a rising interest in innovative programs. in problem-based, competency-based. So there are a lot of people today here listening to you from the different universities, from medical program, nursing program, from veterinary medicine, because they are very interested. We are very happy to have here Azal Abakar, and she's a fourth-year student, and she will give her perspectives. I know that it is very difficult to concentrate in 45 minutes, 6-year program. And so we think that Anna, she did a very important job to concentrate in 40 slides all their program. But we think that it will be very inspiring, and but I know that it will not enough. So please, everybody who is here, if you have questions, write in the chat. Think and write down your questions, and there will be a question and answers session at the end. I hope that this one is the first one of the meeting, the webinar with Anne and Azal. I'm sure that there will be other opportunities in future to go in depth. So I thank everybody. I thank you for the overview, and I leave the floor to you, Anne, and thank you for coming.
Thank you, Antonella, for this very nice introduction. It's always been a pleasure to work with you, and I'm very grateful that we are friends for so long, and I'm longing to come to you again. Professor Parigi, thank you very much for inviting us. Azal and I are very happy that we can share our experiences today with you. And Antonella, you already saw the slides, and you told me this is going to be completely different from our medical program. So I think we have a lot to talk about and to discuss about. Well, Azal and I made a kind of a distribution. I will start with some theoretical background of our education at Groningen, and then she will tell her experiences as a student. She's now a bachelor student, because I think that's much more interesting. I asked another second-year student to tell something about competency development, but unfortunately she was ill. So Azal and I will cover for the whole story. And we are looking forward to your comments and to your questions and suggestions. So for the first slide, thank you, Melania. This is, I show you an overview of the city of Groningen. And maybe I can't show it to you because I can't have the point of it. The city of Groningen, in the front you see the Martini Church, which is famous in Groningen, very old church. But behind it you see a very big building with white and red compartments. This is our university medical hospital and the medical faculty. So it's very unique to have in the Netherlands to have a hospital in the center of the city. So please feel free to come once, because Groningen has a lot to offer. Well, on this slide you see the golden building is the Faculty of Medicine, and behind you see a little older building that is from the former university, which was founded in 1614. And behind the golden building you see a building with green colors and so on, and you see a lot of other buildings. That is our hospital, and we are connected by a bridge. So the Faculty of Medicine and the university hospital are very connected. And it's very logical also because all our teachers come from the hospital. So there is a lot of exchange between the faculty and the hospital. Thank you. May I have the next slide? You see it was good weather on that slide. Today was beautiful weather too. And I want to show you one more slide about Groningen. What you see on the left side is called the Forum. It's a new building, and you see it on the screen within the picture. It's a very high building. It's a public building with a library, but it's also very good for the students to study. And I think that is very characteristic of Groningen. The people of Groningen enjoy to have students in their in their center of the city. And so they have a lot of space for them to study and to mingle with the inhabitants of Groningen. And I think it's really a very nice atmosphere. And the picture on the right is about the academic, the old building where the theses are defended and so on. So this is a little bit about the new and the old buildings of the university in Groningen. And now I would like to explain you a little bit more about our medical education. Can I have the next slide, please? Well, for us, it's different. We have in the medical medication, we have 3 years of bachelor and 3 years of master. I think that's the same in Italy. But the first 3 years at our university are, like Antonella already said, problem-based, patient-based, and they do also some practical works in the hospital or in some other places. And the last 3 years, so the master phase, is completely in the hospital. So it are clerkships, internships, and there is a rotation after 4 or 6 weeks, I think. So you just started with it. You will explain it more in depth later. But I think that is really a big difference with the medical education in Italy. So it's a very training with hands-on. And I'm first going to explain you the content of the bachelor. And maybe I can have the next slide. Oh yes, of course, I'm going to say what you can expect from this presentation. First, we will start with a general introduction. I think because that's important so you can understand our education. And then I will tell you something about the bachelor. And I think it's very important to understand that the bachelor has 3 course units. The first one is medical knowledge. It is called causes of disease. And the second one is the competence development. And the third one, and we are not going to talk about it a lot this time, it's about the progress test, the knowledge test. But we really want to inform you about the causes of disease, so about medical knowledge, and also about the competence development. And the students learn it together. It is integrated. So that's what we want to explain. And Asal was a student of the learning community Global Health, and I will explain you in a while what is our learning community. So maybe I can have the next slide. Oh, maybe you want to, you can explain this later, Asal. That will, because you see a picture on this slide, and it's about Panacea. And Panacea, this is a student corporation, and they are very, very active. And as a program leader, I'm very happy to work with them because they inform us about all kinds of subjects, what is going on in the bachelor or in the master. So we have very often contact and we exchange information. And for us, it's very important what students think, what they want, how we can improve the education. And here you see Asal completely on the right in a nice outfit. Thank you. Next slide, please. This is, I want to explain you too, the Raamplan 2020. The Raamplan is a document in which the learning goals, the learning objectives are written for the medical education for all the faculties in the Netherlands. So we have the learning outcomes at the end of the master, but we have also the learning outcomes at the end of the bachelor. And it is also for medical knowledge, but also for competence development. So that is a very important document, and all medical faculties have to fulfill those objectives, of course, but the way we teach it to our students, that may differ. So we have freedom in that kind of thing. So, but it's a leading document. Can I have the next slide, please? And a little background about G 2020. This is our curriculum now. We have 4 important things. The first thing, that it is self-directed learning, meaning that we tell the students from year 1, you are largely responsible for your own learning. So we learn them to be leaders, to be proactive. And of course, in the first year, we support them more, and in the second year less, and in the third year less. And then we know at the end they should do it by themselves. But it's a very important vision of education, that they are responsible for their own study. We also, sorry, this is my phone. Yeah, we also want to learn them a lot of competences by doing it. So that is really important, and it's really at the heart of the curriculum. And we want to learn them things, what they will need after they are graduated. And we have also the philosophy that they learn something in the bachelor, then they learn something in the master, but then they have to specialize, and usually they have to do 6 more years. So we don't have to put everything in the master, or we don't have to put everything in the master. We try to make an alignment, a constructive alignment, and increase what they have to learn. Another thing which is very important is that it is small scale and interactive learning, meaning that for the medical knowledge, it's problem-based learning in tutor groups. And for the competence development, and you know that were the 2 courses, that's what they learn in coach groups. So they have 2 groups, small groups, and they are obliged to join it. It's obligatory. And we think it's very important that they have also time to self-study. So I think this is also a big difference with the program in Italy. We offer them only 12 contact hours a week, 12. And the other weeks, because it's a full-time study, meaning it's 40 hours a week, so the other hours in the week, they can spend it to self-study or to interactive e-learning or informal group learning. So that's, I think it's, so they come only for 12 hours a week to the faculty. And then, of course, we think what's very important is the competence development. And that is taught in learning communities. And I have to explain you, every year we start with 450 students. And of course, that is a very big group. And students are coming from the whole of the Netherlands. So it's very difficult for them to learn, to know each other. And that's why we divided it in learning communities from about 100 to 110 students. And in this learning community, they get their tutor groups and their coach group, and it is rotating. So they learn to know all the students within their learning community, which make it easier for them to collaborate together, to work together, to study together. So that's, I think, very important of our philosophy. If you have any questions, please put them in the chat or whatever. We can try to answer them. So I hope this is a little bit clear. Maybe I can have the next slide. Thank you. As I told you, we have the learning communities, and we have 3 Dutch learning communities and 1 international. So we're 1 international track. So we offer our education in Dutch and in English, but for the international students, we have a lot of Italian students, by the way, but at the end of the bachelor, they should learn, they would have had enough time to have learned Dutch, because if they start the master, they will have to speak and write Dutch, because they are going into the clinical rotations. They will see a lot of patients, and of course, you have to communicate in Dutch then, and you have to write your letters in Dutch too. And I must say, our Italian students are very enthusiastic and very clever, and they learn to speak Dutch in a very good way. I also have a resident in the psychiatry department. She's also Italian, and she really speaks Dutch very well, which is, I think, a very great achievement also, because it's so different from the Italian language. To give you an impression, every year we have around 1,700 students who want to be admitted. And then we have a selection day, and on the selection day, not everybody can come, but it's obliged to come. Around 1,100 students are coming. And then we have only places for 410 students. So 1 on 4 students can be admitted to our faculty. That's not nice, but that's our numerous fixes that we have. And then the students are divided into each learning community. Maybe, can I have this next slide? Okay. Now we are going to tell you something about the content of the Bachelor of Medicine. And I know it's a little bit complicated, so there are, what I said in the beginning, there are 4 course units. Causes of disease, which is about medical knowledge, and Asal is going to explain you what is our program. Then after, I will explain you about the competence development, which is the 2nd course unit. Then there is also something about knowledge development and the Bachelor Thesis, and we will focus a little bit on them, but not so elaborated as causes of disease and competence development. So we start with causes of disease. Asal, please, would you take over?
Good evening, everybody. I'm really happy to be here. I hope I can share my experience with you tonight. So I'm going to tell you a little bit about my experience as a student in G2020. And as Anna already explained, so our 4 course units are really intertwined, and one of the main course units is the causes of disease. And you can see here the overview of the Bachelor of Medicine, and as you can see, in all 3 years of the Bachelor, you have 2 main semesters running on the causes of disease, which also provides students with a lot of course points and course unit points. And I will just go through it structurally and tell you a little bit about it. If we can go to the next slide. So a little bit about our program in Groningen. As I wanted to start my medical education, I went throughout all the faculties in the Netherlands and visited all the universities to see which one fits me best. And as a young student just out of high school, I really liked the introduction in the open day at our faculty about that they told us that, hey, you're going to start your patient contact, you're going to meet patients on your first day as a medical student, which to me was really interesting, because all other faculties would tell you that you had in your bachelor's and master's, you would just focus on the theory, you would only have anatomy or physiology in the first years. And to me, just being buried inside books and studying and not having patient contact, to me sounded a little bit sometimes boring. So I decided, this is why I chose for Groningen and decided to do the selection here. But that's now 4 years ago. And so as a medical student here at the faculty, you everything on your themes of cause of disease is oriented on patient care and on a patient. And that means that we have, in each semester, the semester of cause of disease is divided into weeks, and into themes, and the themes are divided into weeks. And that way, and every week you have a new patient which is introduced to you, and that way you learn about diseases and topics of medicine. I will go through that in a little bit later. And these weeks and themes are obviously, they're all supplied by practicals. So you can imagine if you have a patient, an elderly patient, and you're talking about osteoporosis, you will have an anatomy practical with the related anatomy of that section. Or if you're talking about microbiology, you will have a practical on microbiology, learning how to use a microscope. That's how the practicals support the education. And we have a lot of small scale education, which is really nice, which you get to discuss the things that you study in those hours of self-study that we have, and we have a lot of those. You get to discuss the questions you have, the things you learned, and as you can imagine, as a medical student, you have a lot to read. We have a lot of very thick books, which you try to read all, but you won't manage to read all at some point. And these small scale educations are really nice because you get to discuss with, you divide, or you say, hey, I read this in the anatomy book on the topic, and somebody else read the pathology, and you get to share knowledge. And this way, like Anna said, you also get to meet everyone in your learning community. I can say now, after 4 years, I know everyone in my learning community, which is really nice. And what's also nice about our program is that all of our teachers, all the people who teach us, are medical specialists or residents, so they can either share their experience or they come straight from the hospital. And there is something really inspiring about the fact that your teacher standing in front of you just came out of the ward and can share their experience on a patient they just saw and educate you on that. So that's really nice. If we can go to the next slide. So I decided that the best way to kind of put in a picture for you how our curriculum looks was by this picture. You can see, I'm going to take the first week. This is the first week of the first theme of the first semester. So as you can see, it says week 1, and then the complaint is chromosomal abnormalities. This is one of the easier topics you can start off with as a medical student. So it says disease Down syndrome. So in the beginning of the week, so the week of the first theme, you will be presented with a patient that has Down syndrome. I very much remember that my first patient was a young patient with their parents, and the child was running around the room very happy, and we could ask the parents questions on, okay, so how is your experience? And as students, we're also taught how to talk to patients. And we get to ask questions. And before the patient comes, we have an introduction lecture from the specialist who introduces us to the topic of, for example, here, Down syndrome or a chromosomal abnormality. We get a brief introduction on the topic, and then we have the patient lecture. And following that session, we have our first tutor session, which in that tutor session, we discuss the patient interview, we discuss any questions we might have on the topic, and we make notes for the next session. I will go back to our tutor education in a little bit in a few slides later. Then we have our analytical reasoning lectures, our seminars, and our Capita Selecta, as you can see on the top. 2 days after the introduction lecture, we usually have a seminar on the topic, and this seminar is picked by the course directors on a topic which students usually find more difficult. And this basically takes a deeper dive into that book or that specific topic, and they explain a little bit more on, okay, so these are the important factors when it comes to such a disease, and these are the things you should remember. And you usually have some preparatory material as students which you prepare for the seminar, to make sure that when you're in the seminar, you are very prepared and you get to ask a lot of questions. And what we have in Groningen is we do a lot of interactive seminars, which means you're always allowed to ask questions, and the lecturers also really like to ask the students questions. So sometimes I can imagine as an international, if you were to enter our session, you would actually be like, hey, is this a lecture? Because there's a lot of interaction between the students and the lecturer, which keeps you on your toes as a student, and you always pay attention, because who knows, you might get the next question. Then we also have our analytical reasoning lectures per week, which basically makes you think as if you were the doctor treating that patient. As an example, with the week of Down syndrome, I remember we had trisomy 18 as a topic of analytical reasoning. So you get a patient case beforehand, and you get to prepare that case. I remember in our case, we had a case of a pregnant woman who was about to give birth, and it was the question of, okay, so what are you going to do? What are the tests you're going to do while the baby's born, when the baby's born, and how is your differential diagnosis going to look like? And I remember that as my first week, I thought, this is really scary. How do I get to choose this? But as the weeks go on, and at some point at the end of your first year or in your second year, you exactly know how to form a differential diagnosis, which I think as a first year medical student or second year medical student is really nice to be able to do. And you basically, during the analytical reasonings, go through the topic of the week, but also look a bit outside of the scope of it. So a bit more of the diseases or issues related to the topic. Then finally, we also have the Capita Selecta lecture, which then again goes and takes a deeper dive into another topic. And then we have the supporting practicals, which in this case could be cell biology or microscopy, but it could also be anatomy or physiology, anything related to the topic. And the practicals are supporting not only the theme, the week, but the whole theme. So you can imagine that a practical, because it's smaller scale education, you might have it in the second week instead of the first week, but since all the weeks in a theme are they're about the same topic, the practicals just match the whole theme of the week, the whole theme of the semester. If we can go to the next slide. Yeah, so this is an overview of the bachelor degree I just received. So these are our themes and weeks in semester 1 and 2 of the bachelor, and then in each year. The darker green is the first year, the light green is the second, the yellow is the third year. As you can see, we have a little bit of everything actually in every year, which is really nice because what I can give as an example is if you look at theme 7 in semester 2, it says injury and trauma. So that's the first time as a medical student here you are introduced to concepts such as the ATLS or basic trauma injuries and the ABCDE, which is, I think, really important as a first year to know what it is. As a medical student, you should know what are the basics when it comes to trauma injuries. But then again, you're just the first year. So you get introduced to the topic, you learn the concepts, but then in your third year, we have, if you can see in the yellow, semester 2, we have more on acute medicine. And that's when your memory of your first year is refreshed. So you have all the topics you discussed in the first year, including more, such as broken bones. And you obviously have more medical knowledge, so you can take a deeper dive into the whole topic of acute medicine.
So maybe can I ask you something? I saw a comment in the chat, but I wasn't able to answer it. Fabrizio is asking, how does the building look like? Do we have only lectures hall or do we have small rooms?
Yeah,
Maybe?
So the bigger lectures, such as the clinical reasoning, the patient lectures, are in a big hall, which the lecture would be for approximately 150 to 200 students. Now with COVID times, a little less, and we also have hybrid education, in which the lecture is live streamed. But the tutor educations, the competency development, which we will go back to later, and the practicals are way smaller scale. So the anatomy practicals will differ anywhere between 20 to 40 students. So you actually have the anatomists helping you and explaining you on a more one-on-one level. And the tutor groups are maximum of 10 students per group, or the coach groups 10 students. So you actually have an older year medical student or a lecturer, and you're in a group of 10. And it's very one-on-one, it's very personal, and you always get to have your say and say your opinion during the classes. So we have a combination of both big lectures and smaller scale education. I hope that answers the question on that. And I see another question on, do the 4 LCs meet? We have, in the competency development, we sometimes have tasks, which we can go to later, which the LCs meet and they have combined lectures. And also the bigger scale lectures, such as the patient lectures, each lecture is with 2 learning communities together. So when you're in a big lecture hall, you have also students from the other learning communities. As students, even if you don't see each other in a lecture hall, you always know who are the students in your year, because you have exams together, you see each other at lectures, and the times of the classes are really close to each other. So when you're at the faculty or having a break or just going out for coffee at the cafeteria or the library, you exactly know who the students are in your year. So you do meet, actually. I don't see any other questions, so maybe we can go to the next slide. This is a little bit of an overview of how the week looks like. I see tutor group on Monday. So this is a first year schedule. You have tutor groups on Mondays and Wednesdays. Actually, our weeks start as the first year. Our weeks go from Wednesday to Wednesday, and second year from Thursday to Thursday. So, and what I mean with start of the week, I mean the introduction and the patient lecture will be on that day. And then following that lecture, you immediately go into the smaller scale education, which you can discuss the patient or the introduction you just received. And as our curriculum is really intertwined. You can see that the Friday mornings are usually reserved for the competency, so the learning community education. I think Anna will talk about it a little bit later. We can go to the next slide. I already told most of this, so how our introduction, patient lecture, and tutor groups look like. And we can go to the next slide. I like to explain a little bit more about the tutor groups. So what's important about the tutor groups, as a first year is a bit difficult to understand, but you soon get a good hang of what the education is about. So in the first session, we define the problem. We say, hey, what is this patient about? What is our week about? And what are the important themes that we need to learn this week? And what you also do in the first session, you analyze everything. So you say, okay, so these are the books we need to read, but also this is the concept of the disease. So if you have a patient with this disease or with this issue, what are the things you need to know of as a doctor? And this could be anything from anatomy to physiology, or anything on treatment, medication, but it could also be the socioeconomic aspects of the disease. And what you do is we have 2 hours. So we have 2 hours to present the patient, discuss the topics, and we then go into self-study. Each student in the tutor education takes a bit of the discussion home and works it out. So decides on, okay, what do my fellow students, or what do I need to know on this topic? What are interesting articles I found on this topic? And what are the most important parts of our learning material on the topic? And then you make a presentation about this. Some people choose to draw on the whiteboard. Some people choose to make a PowerPoint presentation. Some people choose to even present it with another patient case or make a quiz about it. And we go back on the second session on the tutor education, again, 2 hours, and then we present this to each other. And I've experienced this as being one of the most useful things when it comes to learning, because it's really helpful to learn from your fellow students. And I noticed that sometimes you miss things when you read the books yourselves because you have a specific way of reading or studying and other students don't. So you learn from each other how to read books, how to analyze information, and you find that something I might find is very important might be less or more important to someone else, and that's how you balance out your education. If we can go to the next slide. Yeah, and this is an example of our practicals. So our practicals could differ anything from a physiology of the lung and actually doing tests ourselves to test our lung capacity, to anything on anatomy or e-learning. During Corona times, we actually had a lot of e-learning modules, which we then found out were really helpful to keep in our curriculum. And that's our faculty has developed e-learning modules on various different topics, and you can then go through those e-learnings on your own pace as a student. And they're really colorful with pictures and other extra links and information on a certain topic. For example, histology, when it comes to skin and dermatology, it's really helpful to have all these links and images, and you slowly go through the learning modules and you one by one learn everything that there is on the topic. If we can go to the next slide. Yeah, and a little bit about assessments, because to all students, exams are very important. At the end of every theme, you have an exam, and a theme is usually 4 to 5 weeks, and those 4 weeks will be the center of the assessment. But what we do is we have a built-up sort of exam. So the first theme of every exam will be tested alone, but as you can imagine, at the end of the second theme, there will also be questions on the first theme. And this just, as a student, you kind of think, oh no, God, I have to study the first theme again. But now that I have finished my bachelor, I think that was very helpful, because you keep going back to the theme you studied before, and it just assures that you don't forget it. And this doesn't mean, at least for me, it didn't mean that I have to study the previous theme completely again. It just meant reading over my notes again, and just you find it out that's really helpful to go through your notes that you made a month ago, and everything comes back to you. So we have this kind of testing, and at the end of the semester, basically everything has been tested. Can go to the next slide. Anna, I think you want to tell something about the competency development.
Oh, yeah, thank you very much, Asal. I don't see any other questions, so I will continue. And maybe we are running out of time also, so much to tell. So this is the first slide again about the 4 course units. So the students develop their medical knowledge in causes of disease, which Asal explained. And parallel to this, they follow also the competence development. And I'm going to explain to you what the content of competence development is. Could I have the next slide, please? So here you see in the scheme again the causes of disease, competency development, which is taught in the 4 learning communities. And we have a learning community, global health, which is the English track. We have innovative healthcare, which is Dutch track, sustainable care, and intramural care, which are all the 3 are Dutch learning communities. And maybe I can have the next slide. I think you're very familiar with this. These are the CanMeds. I think you use them also in your education. And we find it very important that the students also focus on their development of competences as a physician. Because they will have to deal with changing care, new technologies, globalizations, and so on. So lifelong learning is really important. And that's why we think that to become a good doctor, you should develop also these competences very well. So we start with it directly in the first year. And maybe I can have the next slide. This is a slide from a Vaccinated, as we call it. This is a kind of e-learning in which we learn the students also what is competence development. Because you can understand, with so many assessments in causes of disease, the students think, oh, we have to learn for the medical knowledge. But we also want them to spend a lot of time of competence development, because it's almost 1/3 of our medical education. So we do a Versa test, and then you find this slide on it, and I can explain it to you. As I told you in the beginning, we have 4 learning pathways. We have the competences. The CanMeds are defined in learning goals in the Raamplan, which was for all the faculties. And we put all the competences in 4 learning pathways. And the first learning pathway is professional development. So this is about, for example, it's focused on your development as a professional. So in the first year, for example, they learn about what is a good doctor. So they have to think, what kind of doctors did I meet? What did I think that was a good quality of a doctor? Was it the knowledge, or was he being kind to me, or was it a combination of it? And so they learn in a coach group to develop their own professionalism. And at the end of the first year, they do also a care internship in a nursing home, for example. And the aim is to work together with nurses, dietists, and so on, so other professionals, to learn to communicate and to collaborate in a good way. Because we think it's very important that as a doctor, you don't function alone. You work in a team with a lot of other professionals. So this is part of the professional pathway, which we also deal with some ethical concerns and things like that. Then we have a learning pathway about medical education. This is, of course, how to communicate with a patient, but also how to communicate with other professionals. And this is in the first year taught by psychology students. And they learn about motivational interviewing. They learn to do an analysis. They learn to talk about treatment and share the patient's view in it, so that your patients share decision making. And it's also built up in 3 years until the end. They can make a good conversation with the patient. The third pathway is about healthy aging. And healthy aging is you will develop competencies that you need to adapt an active role as a physician in a changing society. So this is, for example, about prevention and health promotion, which is important in a society, like we saw now with COVID and Corona, for example. We never saw so many doctors and medical specialists on television telling about what they know about COVID, and to give psychoeducation to all the people. So this is a very important pathway also. And then the last pathway is about scientific training. So we learn them to evidence-based medicine, for example, how to do a research, how to formulate a scientific question, how to write an article. And this will, at the end of the 3 years, it will result in a bachelor thesis. And Asal will explain to you what is the bachelor thesis in a moment. So we think all those pathways, they are in the first, second, and third year. And of course, it becomes complexer and more complex after every year. And they are assessed by products. So, for example, for healthy aging, maybe they should make a website about prevention of smoking, for example. Or for the in scientific internship, they will have to write an article. Or for the professional development, they are assessed by how they function in the group. Are they active? Can they give feedback to other students? And so on. And for the medical communications, we have a kind of skills lab in which they perform roles of a doctor and a patient, and we see how they perform their medical conversation with the patient. So this is also assessed, but in a different way, and not an exam like in causes of disease. And we think this is very important to learn to all the students. Can I have the next slide, please? Well, this is about the second year, and the next slide is about the third year. And maybe I'm going to skip the content of this because I think it's more or less the same. It has a different content, but maybe Asal can talk to you now and inform you about a bachelor project, which is the end assessment of the third year of competence development.
I think we can go on to the next slide. I think I have, and the next one.
Next one.
And another one.
Yeah.
Another one.
And another one.
And another one. Yeah. I'm going to tell you a little bit about our bachelor project, which is actually our bachelor thesis at the end of year 3. This is something you focus on a lot of weeks at the final term of your bachelor. And what you do is basically scientific research. You write what we call a bachelor thesis, which is actually a smaller project. I put here an example of my own bachelor thesis, which I wrote a couple of months ago. And so for these projects and theses, in the beginning of your third year, you start searching on, okay, what is a topic I find interesting and I want to do more research on? Then you can there are also projects that are offered to students, but you also have the freedom of contacting a supervisor or contacting a department at the hospital or at the public health municipality and just asking, hey, I'm interested in this topic. Can I do research? And what you do is that you focus basically all the skills you learn through your first and second year, either in statistics, doing research, and patient contact, and you basically combine them all in one. In my example, I really knew I wanted to do a bit more research on children or on or at a clinical department with patients, with kids. So actually my group and you do this in a group, which is in a group of 3 to 5 students. We were a group of 4, which is the ideal number actually. And we did research on how to reduce pain while vaccinating children between the ages of 0 to 5 or 0 to 12. and we basically went, our supervisor was a specialist at the hospital, but we had a separate supervisor at the public health municipality. And we basically questioned the professionals, and we also questioned the so professionals, the doctors, the nurses working, and also the parents of the children. So what do you experience while your children are being vaccinated? And how can we help to reduce this pain? Because our research showed, and also previous research, that a lot of children, a lot of people, adults that have fear of needles, it actually comes back to when they received their first shots as a kid. So basically, we did, this was a research that we did, and our product at the end was our thesis that we wrote, and also we created a website for the professionals, and we created the poster that you can see, which will be hung on the break rooms of all the doctors, professionals at the departments of the hospital, with a code which they can scan and goes to our website, which we explain more on how they can help reduce these the pain during the vaccinations. And this is just an example. I had a lot of friends doing research in dermatology back in the day. When we were doing this, COVID was still a hot topic, so a lot of research on COVID was done as well. I see a lot of questions coming in. Something more about... I think about the assessments, I can tell you a little bit. So what you can imagine with our assessments is that the causes of disease, so the program, which is really the basis of medicine, is tested in the form of questions, the traditional forms of multiple choice questions. But the competency development is actually tested very differently, which most students really like. So every task that you do for your learning community for the competency development has 2 or 3 main can-meds at its core. So you can imagine when it comes to medical consultation, the core will be how to be a professional and how to be a health advocate, or how to be a medical expert. And then in the beginning, you will be told what is an important factor that you need to have as a medical professional or as a medical expert. What are some competencies that they want you to develop with this task? And then during the task, you basically focus on that, and hey, how can I adapt my knowledge into this? And at the end, you will be assessed on those 2 or 3 competencies.
Yes, maybe Melania, you could show slide 27, which is a kind of about the assessment, and also which is part of the portfolio, because all the students have to, yeah, that's one. All the students have the portfolio, and every task that is assessed, they get a grade. For example, for medical communication, or for working together, or professionalism, or whatever. And they get several grades in one semester. And at the end, we make an average of it. And then they get a final grade. So they get a grade after 20 weeks. So after one semester. And then we make an average. So that's, we use portfolios for the competence development. And of course, I saw also an interesting question. What about if they don't know everything about anatomy, for example? Or do we take it for granted? Or, for example, when they have a communication with a student and they have to explain that somebody has something at the hand and they don't know exactly the anatomy of the hand. That's not really important. In the competence development, we look at the medical communication, and the anatomy is assessed in causes of disease, but not all. We just do it integrated to the disease that they learn, because we think it's important to know some anatomy, some physiology, of course, histology, and so on. But not everybody is going to become a surgeon or a generalist or whatever. And so they learn apart from the anatomy in the bachelor. They also learn it a little bit in the master, because I think then they are interested, because they see patients with diseases and they think, okay, how is the anatomy of this disease and how is the pathophysiology of this disease? But then after, they also do the specialization, and then they really start to study what they need for their specialization. So that is our philosophy. So we don't put all the anatomy in the bachelor. No, we do just a part of it so that they understand about the tissues, the muscles, and so on, but they do not know all the bones in the body, for example, or all the nerves. They do just a part related to the disease that they learn. So that's maybe different at your faculty, maybe. So I think I answered a little bit your question, and maybe due to, I see we have 1 minute, let me see if I could in 1 minute show you the slide 31. This is from the master. Because after the bachelor thesis, they finish the bachelor and then they do the master, and the master consists of internships. So they start at the clinical training center, where they learn to do physical examination, they learn to all kinds of skills, and then they enter the hospital and they do different internships. And the first year is in Groningen or in Assen, and the second year it's in satellite hospitals in the region. And they do 10 senior rotations. And the last year, you may choose a rotation in which you are interested in. So, for example, if you are interested in psychiatry, you can do a rotationship of 20 weeks of psychiatry, so that you can learn to understand, is this the specialty I want to go further with it, or do I choose for something else? And we end the master with a master thesis, which is also a research project of 20 weeks. So that's also the academic part of it. I think it's time. I'm very sorry that we have to put in such short time to explain you our medical education in Groningen. The next slide is just an explanation of the master in more detail, so I'm not going to talk about it further. But I'm very curious if we were able to inform you about our medical curriculum, and maybe if you have a last question, we are very happy to answer them and to give you some more explanation if you want to. Thank you for your attention anyway. Antonella?
Okay, thank you. Thank you, Anne. Yes, I think it is really very difficult to concentrate 6 years in 1 hour, but it was brilliant. I think it was very stimulating, very inspiring. I think that our idea is in Italy to try to innovate. And when we say that we would like to introduce problem-based learning or to do, I don't know, multidisciplinary modules or blocks, people, they say that we cannot, it's difficult, they don't understand how to do. And you give us an example that it's possible to have problem-based and competency-based also with 410 students, and to work in small groups and to respect the how to say, what the European community asks. They ask that the students to become medical doctor, they have to do, I don't know, 5,600 hours or something like that. And you can respect, because they work 40 hours, but they come only 12. What I see there is a question. And before answering the question of Monica Forni, she's from University of Bologna. She's a professor of veterinary medicine. And she asked, what about students' willingness to be involved in self-directed learning at the beginning? And I will leave you the floor, but I would like just to say, I think that I was really impressed like I was already impressed 40 years ago when I went to Maastricht, that you and in Groningen, and you also in Maastricht, you plan your curriculum as a whole. I mean, here there is not the teacher, the professor of histology, professor of pathology, is the owner of his discipline, is ours. Here we have the idea that you work as a team all together. We have your competencies, learning outcomes to achieve or to make students achieve, but you work all together in a very integrated way. So I was really very impressed. I think that it will be very nice to go to visit you to understand a little bit better, because it's so difficult. Okay, I leave Anne the floor to answer Monica's question.
Asal, would you answer it?
I think there are two things when it comes to students' willingness. I think the first part is a lot of students in the Netherlands and the international students joining our curriculum, they choose this curriculum. So you have other choices of joining other curriculums. And in the beginning here, you are told that this is a lot of hours of self-study you have to put in there. So you enter it with the knowing of, I have to do this myself. And I think the way our lecturers and our teachers and the older year students guide you in the beginning, it already shows that, hey, this is how you self-study, and and you notice very early on, I think after the first theme already, if you don't put in the hours, you're not gonna make it as a medical student or as a doctor. You need to put in the hours. There's a lot of knowledge to be learned, and there is a lot of information. I think in the beginning, as a 19 or 18-year-old starting medicine, it's a bit tough to put in the effort and actually put in those 40 hours a week. But when it comes down to it, everybody, maybe not everyone will put in 40 hours, but the 30 hours are definitely there. The 35 hours are definitely there, because you need to prepare for those tutor groups. The presentation you give, you need to be prepared. The coach group you go to, you need to present, and people are expecting you to present. And it's not just learning for yourself. Your students in your group expect you. It's also showing up for them. So this feeling of being in a team also really kind of inspires you to put in the work.
Yeah, and if I may add, this is also a topic which is discussed in the coach group with the students. And sometimes we see that the girls are more easier with this, that for the boys it's more difficult to be in time, to have the deadlines, to study. You know, they have to grow up, not all the boys, but they're part of it. And we have 70% of girls, students, female students, and 30% of male. And at the end of year one, I see more male students which have problems with this, that you have to be self-active, than the female students. But usually at the end of the 3 years, they are all capable of doing this. And I think that's important, because I think that as a doctor, you should have an intrinsic motivation, and that you should be able to guide yourself and to lead yourself also to do the work. There won't be anybody saying, oh, you have to do so and so. You have to do it by yourself also. So I think it's a very important competence. And that's why we start with it immediately in year one. Yeah. Thank you, Monica.
Okay. I don't know if we have other questions.
But I have a question for Azal Abgar. We are here in Italy, we are curious about this. Here, a student is studying a discipline. And anatomy is something that you study for 9 months. No, and how do you feel to study some scientific basis correlated to a problem, and you have many different situational information, and how to to put together. It is okay for you? It is good, or is it difficult?
I think that for me, I actually cannot imagine doing it a different way, because I think it's very nice to, so in the beginning, you don't know this, but you soon learn that when you have a new topic introduced to you, whether it's Down syndrome, trauma, or the cardiology, you learn that, okay, if I want to understand this topic, the first thing I'm going to pick up is my physiology and anatomy book. So you pick up those books first, and you first read the physiology, then you read your anatomy book, and the final book you pick up will be your pharmacology book, because you understand the basis, you understand the disease, the clinical medicine, you understand the pathology of what can go wrong, and then finally you pick up your pharmacology book to see how you treat it. And this is something it took me the first 2 themes to learn, because as a first year student, I loved my clinical medicine book. I always wanted to know what the clinic is about and what does the disease look like, but soon learned that I have to start with the physiology and anatomy of the topic in order to understand the rest. And I think it's really nice, because this combination of in 1 week learning the physiology, the pathology, and then finally the treatment, it makes the disease or the topic stick to your brain very differently than studying 9 months of anatomy on all the different body parts.
Thank you, Giuseppe Pino, because this one is the big question in Italy. No, it seems impossible to study medicine in a non-systematic way. And ciao, Gabriella comes. Gabriella, she is a professor of biochemistry at the University of Pavia. Thank you for sharing. They would like to do faculty development activities. And I think that if we run faculty development activities, we propose problem-based learning. And people then, they are fascinated. They would like to introduce, but they say, how is possible to train medical doctors without a traditional program? In Italy, we are used to have preclinical years and then clinical years. Preclinical years, there are histology, anatomy, physiology, and you study in very systematic way. It seems impossible to study in a different way. I know for Anne it's impossible to understand because she was trained in Maastricht. So she has never had a very systematic approach. But I think that this webinar seems it show us that it's possible to train people also by with a problem-based approach, a competency. And I think that in Maastricht they had the problem-based. Here there is some more because they have problem-based and competency-based linked together, different groups. And I think it was really very inspiring. And I'm very, very happy. I see there is Margherita.
Her daughter should have come.
Margherita, she's professor of health statistics at the University of Bari, and she was one tutor when Anne was in Bari 35 years ago, and she was a tutor of PBL. Wow, so nice to see you here.
Margherita, I still have to think of statistics. We do that in the first year now. They learn a lot of statistics and then we end it after 1 year. Yeah.
Okay.
Nice that you were there. Thank you.
I don't know if there are some other questions. Okay. I think that it's time to close, perhaps. I have a lot of questions, but Pino, let's be honest, Italian students study anatomy at the first and second year, forget it.
Yes. Yeah. Well, that's something about just-in-time learning. I think when you really want to know something about anatomy, because it's important when you have to treat a patient, then you have to learn it, and then of course, you have to know the basics. But to get more detailed information, I think just-in-time learning is important. Yeah, okay. When they study college, yeah, okay.
Now, I think that it's very interesting to see also that it's possible to organize in another way, splitting students in these 4 learning communities. We call it canale. channel in Italy, and they should be channel with 70 students. We have with 100, and it would be possible to have one in English, one in Italian, but also different topics as with major. And then also the fact that we have this small scale to divide in groups of 10 or 20, and also the themes. I think it's very interesting. We should invite you again to explain a little bit more. Okay, I think that perhaps we could thank so much Anne and Azal. And Anne had the idea to invite Azal. I think it was a very nice idea to have also the students' perspective. And we thank you very much for all your keynote speech. And I also hope to have you again in Italy, also in presence, to help us to understand in depth, and also perhaps to help our colleagues that they want to introduce problem-based, competency-based in their program.
Yeah,
and thank you very much.
You too, Antonella, for inviting me, and Professor Parisi, thank you very much. It's very nice. And I realized that we only gave information, but of course we are very curious how you do it in Italy too. But it was difficult to exchange now, but Antonella tells me something. But thank you very much for listening to us, and be welcome to come in Groningen if you want to.
Okay, thank you. Bye-bye. Thank you.
Thank you.
Bye.
Bye.